Hello, everyone. My name is Keith Lyons. I am a licensed clinical social worker, certified clinical anxiety treatment professional, a certified clinical trauma professional, level 2, with an emphasis on complex PTSD, as well as a clinical service provider for ADHD. I currently work for the nonprofit Family Health Centers of San Diego, who have multiple locations throughout California. And I'm going to be presenting information on how to approach individuals within a healthcare setting with trauma-informed methods that have shifted greatly over the last 2 decades as far as our approach and understanding of the foundation of trauma and where it stems from. So first, it's good to identify what trauma is, and we're going to turn to the good old DSM-5. And when speaking specifically of post-traumatic stress disorder, so there's acute stress, there's, other radical attachment, there's all kinds of other areas that are located within the trauma section. But for post-traumatic stress disorder, which is one of the most complex and difficult ones to address, there needs to be an exposure to an event where the person is involved or they have the possible threat of death. It doesn't actually have to be they were in a situation where they did almost experience death. There could have just been the feeling of believing that it was absolutely possible. This does not have to be directly experienced. They can actually witness it as a bystander. They can see it happening to another person. They can learn about it happening to somebody that they are close to, and that can be enough for a marker. Also, if they're repeatedly exposed to various what we may call small t events, so small traumas, which might be just repeated exposure, like first responders dealing with people who are on the verge of dying or seeing young children in distress often. There needs to be presence of one or more of the identified symptoms in the DSM to qualify, which can be hypervigilance, nightmares, disassociation in some form, abreactions, which are commonly known as flashbacks, intense physical distress, or physiological markers, which is something that we've been beginning to focus on more as we've moved forward. The duration of the symptoms needs to be at least a month or longer. There needs to be an impact negatively on their cognition, and the individual may also exhibit persistent attempts to avoid triggers like people, places, and things that remind them of trauma. The first thing that happens to begin the trauma process is a significant event occurs. So this is a negative, or it can be mostly negative. It doesn't have to be terribly intense. It can just be a statement made by a caregiver as a child that's just confusing or complicated. So it can be a very easily identifiable event, or it can be a series of events which often contribute to complex PTSD. It can even be almost a near neutral event that doesn't seem too negatively charged, and the individual may not have felt like they were being negative in any way with their behavior statement, but the person's perception is what matters. So what happens is the client then records 3 pieces into their memory. So they record anything that they see, hear, touch, taste, and smell. They record the physical energy within the body, and they also will record a negative cognition, a negative belief that is about themselves in relation to the event that just occurred. With healthy memories, the brain is able to take the incoming information of what you see, hear, touch, taste, and smell, discard the energy because it's already come and gone and processed and served its purpose, and it doesn't maintain the negative cognition because that would not be conducive to the evolutionary process of survival of the fittest, etc. This is just at the core of our drive as animals. We are mammals. Number one priority at the most basic piece of our brain, the brain stem, is survive, procreate, continue. So with this experience, the trauma memory is attached to the negative energy in the body. It's attached to the negative cognition, which has not been discarded, and it essentially is stuck as its own separate network, which is in the active memory, and it is not downloaded into the adaptive memory. So the trauma network becomes stuck. It is in a way that the mind and the body perceive it as still happening. It is not something that is identified as past threat. And this is why you see people become triggered. This is a survival response. So the brain wants to always know what's going to happen next. That way we are always prepared and we can survive. So our brain is always taking past information and using it to try and guess what the future will bring for every step and every moment. When this memory gets stuck, then the issue is that when there is an event in the present that reminds the brain, or the brain makes a connection of something that you see, hear, touch, taste, or smell in the present, and it triggers an association to that past trauma memory, that gets lit up. So now you're responding in that moment to whatever is going on in that moment, which may not be anything or feel like anything. And then stacked on top of that is the negative energy, the negative belief of that stuck trauma network. And that's why it can feel as though the individual is overreacting in that moment. The logic centers in the frontal lobe, they basically become inaccessible when you go into this fight or flight trauma response. And so the guiding force becomes the limbic system, the emotional response, the compulsion, and the drive to survive. That animalistic core to survive takes over for any kind of logic balance to that emotional drive. So basically, the past drives the present. Now, using rational and emotive behavior therapy, which is a great way to understand how we respond each moment in the present, is identified as ABC, which is there's an activating event, commonly known as a trigger. Not inherently bad. Triggers are anything that you can see, hear, touch, taste, or smell, and those influence your thoughts and other things that we're going to expand on. But after the activating event, you then have a belief, which is your perception of that event. This is based off of what you're sensing in that moment, and then that past experience that you have had. So if your partner is going to breaks up with you, and you become very overwhelmed and begging and pleading, it's likely that you're responding to past experiences of relationships where you may have felt abandoned by caregivers or people who were close to you, or felt as though your relationships have always ended badly. And so that fear from those experiences is brought up along with the current experience. So your perception is based on what's happening in that moment plus everything that you've experienced before that informs what you expect to occur. Because of your perception in response to that activating event or trigger, there's then a consequence, which means there is an emotional response and a behavioral choice. So the person has that emotional response, and then a behavior is chosen to address the situation that's occurring. The problem is that this present moment, again, is being impacted by past events, which are resulted from the trauma memory. So the perception of the event and the emotional behavioral response can be distorted by past trauma. It's not as clear cut as event, belief, resulting emotion, behavior. CBT focuses on the negative thought as a way to change a person's behavior and emotions, which is valid. Cognition affects behavior, affects emotions, and it's a loop. However, with trauma theory now, in most of the approaches, the idea is that the negative thought is actually just a symptom. It's not the core. So it's the leaves of the tree that are browning, but they're browning because the roots of the tree are sick. So the negative thought distortions come from a deeper rooted issue due to trauma that is stuck in these trauma networks and not integrated into the useful adaptive memory. Now we're going to focus on the brain and how stress impacts this. With the brain, it is first flooded with stress hormones, adrenaline, cortisol, norepinephrine, when a threat is identified. The parasympathetic nervous system is the nervous system that's responsible for slowing this down, bringing your heart rate down, controlling your breathing, controlling digestive, and many other things. So when your nervous system becomes dysregulated, you will have these many physical symptoms that are occurring. The brain becomes hypersensitive to threats as it is exposed to more and more of them. So The amygdala, which is basically the fire alarm of the brain, its job is to assess incoming information and identify, is it a threat or not a threat? The amygdala actually can enlarge in size. So like a muscle, it can become bigger and better at finding things to be afraid of. This is especially true in society because we are overwhelmed with possible threats compared to when we used to live in small villages many, many years ago. So the amygdala is taught to be overreactive. It's a survival response. It's meant to make you always identify any possible threat so you can survive. However, it's become overwhelmed with the way society has evolved. The ability to make decisions is almost non-existent when someone is activated in trauma. The frontal lobe is unable to communicate correctly with the limbic system and the amygdala and the hypothalamus and everything else that's been activated by the trauma response. So thoughts can then present as irrational, behaviors become impulsive because the person is in a survival response of, I must fight or flight. There is also a freeze or hypofreeze, but we'll get into that later. The brain learns to hold on to negatively charged events. This is again a survival response. You know, going to Disneyland and having a great day is not something you need to remember in order to survive. Your father attacking you on a daily basis is something you need to remember to survive. You need to be prepared to deal with him. But then this gets associated across time to general, like all males or adult males or males with black hair, etc. This also, our memory is impacted. The hippocampus is actually connected to the amygdala, and the hippocampus is responsible for memory, among other parts of the brain. So these negative experiences are highlighted by the hippocampus, locked into long-term memory as, hey, that's scary when you see it, so you need to fight or flight. Now, with the brain, we look at the triune system approach, which is the brain is split into three main systems. There's a million systems, but we're focusing on these three core areas as a way to understand overview of trauma in the brain. The frontal lobe or neocortex, that is the human brain. The middle brain is considered the mammalian brain. This overrides the frontal lobe in these anxiety, fear, trauma, panic responses. Finally, we have the back part of the brain, which is also known as the amphibian brain. This is the brain system. This is the part that keeps everything running. This is just something from a research article that I liked to remind that not one region in the brain drives or controls anxiety on its own. Various regions throughout the brain interact with one another. So we're looking at simplified versions to understand, but that doesn't mean that this is the pure definition of fear, anxiety, and trauma. Now, there's regions in the frontal lobe, as we said, in the neocortex that actually control the emotional response from the limbic system in the middle brain and the impact of the amygdala and all those things we mentioned. So the frontal lobe actually, in simplified form, the amygdala takes the information, says it's dangerous or not. Yes, it's dangerous. We're going to activate. The frontal lobe comes in and says, hold on, let me look at this too. Let's use the logic of what we know, not just emotion. And the frontal lobe then says, okay, yeah, that's a threat, activate. Or it says, no, that's not a threat, here's why. Activate the nervous system, parasympathetic nervous system to begin calming the body now. In a trauma response, the person is suffering from a disorder, so the limbic system overrides the logic of the frontal lobe, almost basically blocks it out, it's inaccessible. So logic balances emotion is not available in the trauma response. Looking at each section individually, the amphibian brain at the brainstem includes the medulla oblongata, which is the control center for heart and lungs. So it keeps you breathing even if you don't want to. That's why you can't hold your breath. You're going to breathe. Your body will make you. It's also motor and sensory signals between the mind-body, between the spine and the mind, which is just more evidence that there is a mind-body connection and that they are not isolated. It's automatic functionings, breathing, swallowing, digestion. That's all controlled by the brainstem. It also controls the pons, which has sleep and arousal. So that the brainstem is what releases melatonin, which is the chemical that helps you get to sleep, and then it releases other chemicals to help you be awake and alert. It's also associated with balance and equilibrium. So these are all basic survival things that any animal needs, and every animal has this brainstem. The middle brain is the mammalian brain. It's a little bit more advanced. This is where the limbic system is. This is where emotion basically lives. This is where sensory input and everything coming in through all your senses is deciphered and distributed throughout the brain and body. The amygdala is located in this area. That's your fire alarm. That's the one that says, is this dangerous or not dangerous? And then it activates various hormones to be released into the body. The hypothalamus, the amygdala will basically communicate to the hypothalamus. The hypothalamus then relays a signal to release certain hormones to set off the stress response in the body. And the hippocampus is also assisting in this process of releasing adrenaline and cortisol, and it's also recording the incoming memories. But because the hippocampus is also involved in the threat response, that's one of the reasons why memories can be so distorted or memory can be bad for people who are dealing with trauma, PTSD, etc. The neocortex front of the brain is called the human brain. This is the most advanced. We as human mammals have the most advanced frontal lobe. This is our voluntary movements. It's part of our memory, our ability to think, logic, decision making. This is why we can see two roads, one on fire, one full of candy, and we can say which one probably makes more sense to walk down. I guess that depends on your needs, but you get the point. This includes the parietal lobes, which is the sensory information processing centers, the physical sensations or somatosensory cortex. It's essential for processing our incoming touch haptic feedback. The occipital lobes are also part of this, which process the visual information that's coming in through the retina, which comes in sine waves, and then the brain deciphers those into thoughts, images, etc. Now, the body is the other piece of this. There's a connection between the brainstem and spine, which is kind of the physical proof of the mind-body connection, but where the mind goes, the body goes, and where the body goes, the mind goes, which is why trauma has shifted in years where the focus can be on the body, because that helps to alleviate symptoms in the mind and teach the body and mind to be less activated by various triggers. So with the body, when the trauma response is activated or anxiety or stress, the body is then flooded with chemicals and hormones that are catabolic, which means they're bad. They break down your body. They break down your muscles. It's like activating nitrous oxide in a vehicle. It's okay to do for a few seconds. The engine can handle it. But if you keep blasting nitrous oxide through the engine's going to break down, blow up, whatever. So the body's meant to be able to handle these boosts of adrenaline, cortisol, these things that make you more alert and feel almost superhero-like for those moments of survival. The adrenaline is released by the adrenal glands, heightens your ability to speed up focus, attention, and survival. This is like when you see the mom lift the car up for the kid to get out. It's the adrenaline and everything else being dumped in her body. The cortisol is a steroid. It helps with the blood pressure. This is communicated by the amygdala to the hypothalamus, which releases a hormone to tell the pituitary gland to release another hormone, to the ACTH to release cortisol. So it's a very complicated process, but it happens in a nanosecond. And norepinephrine is also released. It's a backup to adrenaline, so it basically is just another hormone or chemical to activate heightened senses. Many operations shut down in your body, by the way. So that's why a lot of people who deal with high anxiety, stress, or trauma, they'll have often stomach issues. The digestive system is shut off during trauma response because the blood used for the digestive system is redirected to more vital responses and vital organs, such as the muscles for fight or flight, etc. So the regular exposure to trauma, anxiety, and stress increases a ton of different health markers. Heart disease, mental illness, obviously, diabetes. It decreases sleep performance, which means other issues are going to result. And the overall response of what's happening in the body is the nervous system is being shifted all the way towards the sympathetic nervous system, which is the hot system or activated system, which is what starts to trigger all the things to be released in your body and get you ready to fight or flight from whatever is in front of you, or freeze if overwhelmed, which will be expanded on later. Just a quick overview of these symptoms. Cognition becomes difficult. You have pressure in the head. The heart begins to pump harder and faster. This is because the body is trying to move blood rapidly from non-vital operation to vital organs as well as to the muscles to build up explosive energy for fight or flight. Also, the blood vessels constrict, so the heart is now having to pump harder to move blood through smaller tunnels, essentially. The blood vessels constrict because this way, if you are attacked by the lion, which is the analogy we'll use, if it cuts you, you don't bleed out as fast, which means you have longer time left to try and fight or flight. The digestive system halts because you do not need to digest food, so the body takes all the energy and resources from that and moves it to other processes like the brain and muscles. Focus becomes tunnel vision. You don't notice things in your peripherals. That's because if there's a lion in front of you, you don't need to notice anything else. You need to keep your attention strictly on that lion for fight or flight survival mode. Muscles become tense, sore, warm. This is because all of the blood is being redirected, the energy is being redirected, everything is going into the muscles to basically build up as superhuman strength as possible for survival, for explosive energy, for fight or flight. The lungs begin to work faster, harder, more shallow. This is because they're fighting to try and pull in oxygen as fast as possible, because oxygen is the fuel to move the blood, to fuel the muscles, and so we need more fuel to be able to manage this increase in activity. You also begin to sweat. This is your body's system trying to cool you down because your core temperature has increased due to all the excess activity. You shake because the adrenaline is released into your body to give you hyperfocus and, again, those quote unquote superhuman abilities. So as you can see, everything that happens to you makes sense if you're running from a lion that can take your life. But it doesn't make sense if you get a bill in the mail you can't afford, or if your car doesn't start and you're going to be late for work. You can't fight or flight those, but your brain has a disconnect between understanding actual life threats versus social threats. One of the major things that we need to be aware of in the body when we do trauma treatment is the vagus nerve, also known as the wandering nerve. It goes throughout your body from your cranium, your larynx, your pharynx, and your throat, to your ear, to your heart, your lungs, your pancreas, your liver, your kidney, your small and large intestine, your stomach, all throughout your body. This is essentially the nerve that is responsible for regulating your nervous system to bring you back to calm or homeostasis after you have been activated. So you step on the street, almost get hit by a car, your survival response makes you jump back before you even have time to think. You're activated, breathing fast, then your breathing starts to slow down as your body and your mind start to understand that you're safe now and the threat has passed. People with trauma disorders, anxiety disorders, etc., this ability may be damaged or lacking. The vagus nerve may even be damaged, and there's ways to focus on healing it. There's 12 cranial nerves in your body, and the vagus is the longest. It has two main components, somatic and visceral. So basically, touch feedback, feeling on the skin, and then internal sensations for your organs. Sensory functions are it processes somatic information, so haptic feedback, things coming in through the throat and ears. Visceral information for the larynx, the lungs, the heart, the digestive system, and it has a small role with sensation in the roof of the mouth and the tongue, which there's stories of people experiencing mental health symptoms after a bad dental experience because the vagus nerve was damaged in the process. For motor functions, it stimulates your muscles, controls the throat, it stimulates muscles in the heart, helps to lower your resting heart rate, it stimulates digestion. So it turns on all the things that you need back on to function in the calm state once you're coming back down from being activated. It helps to bring you back to your homeostasis. If damaged or dysregulated, it can lead to a ton of different things: heartburn, constipation, fatigue, muscle weakness. It can even lead, and anxiety, panic, and it also can even lead to fainting. So this is vasovagal syncope. It's when the person experiences fainting because the vagus nerve is so overreacted to a stimulus. The vagus nerve is responsible again for calming you, lowers your blood pressure, controls your heart rate, helps decrease your anxiety. So it's incredibly important to identify, pay attention to, and to put into a health plan practice for the vagus nerve. The polybagel theory is the way of understanding how to approach the vagus nerve in treatment. So the first concept is co-regulation. It's the concept of the nervous system searches for signs of safety and danger. So it's neuroception, which we're going to get to next, but your body has the ability to sense things even before your mind and to give you signals even before your mind. We're in a constant state of drive to survive versus social needs. So we need to connect with others, but we also have a response in our body and mind to be, careful around others because they could be a threat. So there's this conflict that we have to regulate in our body and mind. So as we regulate these, we can co-regulate with others, and we're able to seek out these connections with other people, or we can increase our reactivity and reinforce negative behaviors of avoidance and isolation. Neuroception is the autonomic nervous system. It can take in information without the brain ever being involved. So you can get signals through just your nervous system, am I safe or in danger, if you can really practice that mindfulness of identifying and developing your neuroception, your ability to identify your body's signals. When there's a mismatch in neuroception, there's an inability to calm your nervous system, Hypervigilance is common. This leads to high-risk behaviors due to avoidance, trying to survive, etc. The hierarchy of what's going on here with the nervous system. So we have the sympathetic and we have the parasympathetic. Parasympathetic is the calm system, sympathetic is the activated system. But it's a little bit more complicated than that. There's the parasympathetic nervous system, ventral vagal. This is when you're in a sense of safety. You feel socially connected. You feel like your mind and your body feels regulated at homeostasis. Then you can move into the sympathetic nervous system, which is the flight or fight, which is going to activate all those symptoms that we discuss. Further is the dorsal vagal. So you can go back into the parasympathetic nervous system, but it's now the freeze response. This is basically your brain and body saying, you can't fight, you can't flight, I'm taking over, we're removing you from this so you don't get destroyed, traumatized, etc. So you conserve energy, you go into shutdown mode. This is kind of like playing possum. So you move from the ventral vagal to the sympathetic nervous system when activated, and if overly activated and felt like, feelings as though there's no way to get away, you move into the dorsal vagal, which is the freeze response. This is that battle between human versus animal that we have to deal with. The evolutionary drive as a mammal to survive, and the human drive to socially connect with others and have to take risks. Next, we look at the approach at dealing with trauma and the symptoms that we are discussing and that we mentioned. Some of the old approaches, such as exposure therapy, still exist, but they have been adapted as we've learned more about them. But a lot of the approaches to trauma-informed care now they essentially focus on the body. The mind will follow the body as the body will follow the mind. And it's easier to go through the body and give people control of their nervous system and regulating their body than it is to just have them try and think their way through their issues. So the approach that I use, that I put together, is just simply called LEAP. So this is the best way to approach and meet the client where they are when you're dealing with trauma or any other disorder or issue that you're helping them with. First, you want to lay the foundation. You want to resource them and make sure that they're safe and they can even focus on their mental or physical health. Next, you want to educate. You want to have them be prepared for the different coping skills and things that they're going to be learning. The more they understand why something works, the more likely they are to buy into it and to use it. Next is to activate skills. Patients have the abilities that they need. We're here to help them understand that and find those. So we want to instill self-efficacy by helping them identify various tools that they can use. Finally is process and heal. This is where you actually focus on maybe going to the roots of the tree, digging up the trauma, healing the trauma to build resiliency and long-term success for the patient to maximize their abilities and potential throughout their life. Lay the foundation. It means connect with any resources to ease their stress. If they come in and they say, I'm homeless and I'm depressed, you don't start talking to them about depression. You need to figure out if there's anything you can do about them being homeless. Safety needs to come before they can focus on the depression. If they're suicidal, that's a different discussion. You need to identify their most stressing concerns. They know what their most distressing concerns are. They know what bugs them the most, and that's what you need to go with. You need to meet the client where they are. Housing, food, disability, do they have finances? Do they have medical access, clothing? Are they using substances? Do they have childcare? Do they have children they're dealing with? Do they need support groups and social connections, etc.? You have to build rapport through this process, and this is a great way to do so because you're already resourcing them, showing them that you care, showing them that you can help. So you build rapport also not only through resourcing, but by explaining your process, your methods to the client. Let them know what to expect if they're going to work with you so that they're not always wondering why you're doing what you're doing or when you're going to do what they thought you were going to do. Safety. This is the core foundation, first thing of Maslow's hierarchy. So that is first. Next is educate. Provide psychoeducation about their symptoms, an overview of what trauma is and what anxiety is and why they feel the way that they do. Talk about it and how it relates to depression, psychosis, and their ability to interact with others. The more they understand, the more they're going to follow through with interventions because they understand the theory behind it. Identify the various emotional behavioral consequences that they may deal with because of it. Discuss why they occur. Help the client understand they're not broken, they're not crazy. Their mind and body are dysregulated. Their mind and body are actually trying to do what they were built to do. There's just a disconnect because of the animal drive and the human drive. Next, you want to activate the skills that the client has, which means build coping skills. Identify coping skills that they can buy into, that they're willing to practice, figure out best ways to implement these so that they stick with them, build new behaviors to start to distinguish the old behaviors. If you practice anything long enough, you get better at it. If you play piano every day, but you don't want to be good at piano, too bad. You're going to get better at piano just by the sense of practicing it every day. When you get in your car, you put your seatbelt on without thought. That's because you were told to do it when you were a kid by your parents who said, you know, you're going to fly out of the car if you don't. And then eventually you remembered, and then you had an intrinsic drive to want to do so for your own safety. And then it just becomes locked into your implicit memory. It's not even really of your awareness. You walk to the car, you get in the car, you put your seatbelt on. The client has to be able to identify their physical symptoms. They have to be able to know when they're starting to get dysregulated. So these coping skills include identifying symptoms as well as what to do with them. So you want to give them proactive activities and reactive. So proactive would be like a self-care plan, an action plan, things they do on a daily basis like exercise, diet, sleep, whatever, meditation, and things that they do when they already feel dysregulated, deep breathing, grounding, body relaxation, etc. Identify social opportunities for them to be able to practice these coping skills. So help them get real world experience. You know, when you leave the house and you go to your car before you start to drive, do a regulation exercise, do some deep breathing, do some body regulation. When you're out at work, you can't just escape. So maybe say, I have to go to the restroom and leave for 2 minutes to regulate. Or in that moment when somebody's speaking, just shrug your shoulders and then drop them to release muscle tension. Take in a big breath and hold for 4 seconds and release. There's things that they can do in the real world that people don't notice so that they don't feel awkward or that they're not less likely to follow through due to these expectations. Finally, process and heal. This is the final step. You identify traumas, you can help them clear or process, reprocess these memories through different things. Anything from the traditional talk therapy, you know, to more of the body-based things, um, mindfulness, DBT, you can utilize EMDR. There's many different modalities. You want to integrate the trauma as a past memory rather than a living event. You want to create a long-term plan so that they have proactive strategies as well as those reactive strategies we mentioned, but written down somewhere. Have a plan, have an action plan that they can review. Remember, when they're in those modes, they can't utilize logic. So if you have a plan that says do this, do this, do this, do this, they're more likely to be able to do those things and get the relief they need rather than try and think in that moment, okay, what do I do? What did I do last time? What did my therapist tell me? You can utilize written exposure therapy, sensory motor, which is body-based psychotherapy, EMDR is excellent, internal family systems. There's a ton of different modalities that you can use together or separate. Treatment options, which is what we just hinted at. These are some of the newer ways that we are dealing with trauma in the last 2 to 3 decades. First off, we got to remember the mind follows the body follows the mind. They are not separate, they are together, and they both must be addressed. When there's a significant trauma response, whether it be anxiety, panic, or whatever, the mind is basically telling the body to trigger all these things to happen because it perceives that you are in danger in that moment, but it perceives that your life is in danger. In the mind-body approach, we can go through the body and then the body can influence the mind, because I'm pretty sure most of the people we work with that are dealing with anxiety and trauma and panic have already tried to think their way out of it, and it doesn't really work. Top-down approaches are the old school traditional ones, which are still valid. This includes CBT, talk therapy, these things that identify that changes through cognition will change the behaviors and the response and the emotions. This is, as we said, the traditional talk therapy, but it basically just focuses on the mind as the source of the disorder. Bottom-up approach. This focuses on the body as a significant source of the disorder in connection with the mind. And the approach is to go through the body to help the mind also heal. These are some of the basic techniques that you can utilize for body regulation just to get you started. 4x4 breathing. Breathe in as you count to 4, hold your breath for 4, breathe out as you count to 4, repeat 4 times. 4x4, really simple, takes about 30 seconds. This manages the change in the breathing if someone is activated, and it triggers the nervous system to want to shift back over. It triggers the vagus nerve system. Noodle, this is something that was adopted from Dr. Eric Gentry in forward-facing trauma therapy. Basically, you intense your entire body, hands, arms, pelvis, shoulders, everything, as tight as you can, hold for about 5 seconds, and release everything without any effort to hold anything up. This triggers the nervous system to shift as well by releasing muscle tension. Noticing your peripherals. As we identified before, when you are in fight or flight mode, you do not notice things in the peripherals because your body believes that you're focusing on the lion in front of you. So if you can get yourself to notice your peripherals, you're kind of practicing yourself grounding in that moment, mindfulness, and identifying that you are actually in a safe environment. Diaphragmatic breathing, this is where we use the diaphragm to breathe. When we are activated into the fight or flight mode, we are unable to breathe the correct way typically, unless we actively focus on controlling it. The best way that I tell clients to do this is interlace their fingers, hands behind the head, elbows back so it opens your chest, and then taking deep breaths while you try and expand your stomach but not move your chest, and that's utilizing the diaphragm. You can test how you breathe at any moment by putting a hand on your chest, a hand on your stomach, taking a normal breath, and see if your hand on your stomach moves more, your hand on your chest moves more, or maybe just the chest moves and the stomach doesn't. Might be a good idea for you to also practice diaphragmatic breathing, which I do myself too because it does help greatly. Slows down the breathing, activates the vagus nerve to stimulate the calm system, basically telling the body you're calm, which then communicates back through the spine, through the brain, spine cord to the brainstem that, hey, we're okay. Progressive muscle relaxation has been around for a while, or PMR. This is a great one because it's run on a set script, so you don't even have to really memorize how to do it. It focuses on targeting the body parts systematically, and it also incorporates mindfulness as well as like physical, muscle relaxation. It incorporates tension and release techniques. It incorporates mindful breathing and awareness of these tension, of what the tension feels like, and also what it feels like when the tension leaves the body. It strengthens your sense of mind and body, so it strengthens that connection. It can be done in 5 minutes, 20 minutes. There's no time limit on it. Grounding. This is important because when you are experiencing trauma, it is because you are activating that trauma network that is from the past, but it feels like it's experiencing in the moment. Anxiety is the same. Anxiety is usually fear of the future, fear of what may happen, being in your head and being afraid of not knowing, etc. Grounding pulls you into the present. This is basically done through your senses. So awareness of your environment is going to show you that there are no immediate threats to your life. Grounding pulls you into the present where there is no danger, and it uses what you see, hear, touch, taste, and smell. Because you can only see, hear, touch, taste, and smell in the present. You can't in the future or the past. 5, 4, 3, 2, 1 is the most simple technique to remember. You can arrange these in any order, but basically 5 things you see, 4 things you hear, 3 things you can touch, 2 things you can smell, maybe 1 thing you can taste. And you describe these things in excruciating detail. So I see a clock. The clock is round. It has black around the rim. There's 3 hands. 2 are black. One's longer, one's shorter. There's a red one. The red one's moving, the black ones aren't. There's numbers. They're spaced evenly. There's 1, 2, 3, 4 dashes between, etc. So you describe in detail because you're pulling yourself out of your head, out of the future fear, out of the hypothetical possibilities of danger, into the present moment, which is safe. A grounding box is a way that I have clients, they have a box that they actually can build, they can do a craft with it if they want, and they have something in the box that engages each sense. So for smell, they might have lavender. For sounds, maybe they have a CD or they have a song written down that they can play on their phone, or they have relaxing music. For touch, maybe it's a piece of sandpaper, a comb, the Chinese medicine balls that you can roll around in your hand, a fidget spinner. Into the earth body scan, real simple, start at your head and start to scan down your body. Notice if you can feel your forehead, the tip of your nose, your ear. And as you go through, you relax every piece, every muscle in that body, and you feel like almost like a tube of toothpaste. You're squeezing all of that tension down, down, down to your feet, and then you just lift your feet off the ground and that tension is released back into the earth. Take a cold shower. Very cold temperatures activate the vagus nerve, which means that's going to stimulate you to the calm side of your nervous system. Okay. There's many other methods that you can look into that we don't have time to go over today, unfortunately, but I utilize many of these. Tapping, emotional freedom technique, has been shown to provide some relief. Tai Chi to help balance energy. Exercise obviously dispels excess anxiety and it helps the body learn to be at homeostasis. Diaphragmatic breathing we mentioned. Singing, dancing, chanting, those are all things that stimulate the vagus nerve and practice vagal toning, which improves health of the vagus nerve. Somatic experiencing techniques. This is a lot of stuff by Peter Levine if you want to look into that. Sports, boxing, MMA, things that activate your body in many different ways. Vibroacoustic therapy, you can utilize tables or chairs to utilize sound at low frequencies to penetrate through the body. Vagus nerve stimulation through various techniques. Art therapy, trauma-informed yoga. Trauma release exercises is another technique you can look into. And of course, nutrition. The microbiome in the gut is important. Over 90% of serotonin, which is quote unquote one of the happiness chemicals, is created and processed in your stomach, not your mind. Therefore, your stomach is an important source to focus on, and it is a big player in mental health symptoms as well. Recommended reading, if you want to follow up on some more. Man's Search for Meaning by Viktor Frankl is just a great book about a man who was in the concentration camps and survived, and it talks about how he stayed positive through all that. Forward-Facing Trauma Therapy is a great simple summation of many of the foundational understandings of trauma through the body. Waking the Tiger by Peter Levine, he associates our response to trauma to the trauma that response we see in animals. It's very interesting and helpful for clients and clinicians alike. Getting Past Your Past is a great book for clients to read to understand EMDR, which is eye movement and desensitization reprocessing. It's hard to say. I am trained in this, and it's a great modality, and it works excellent in 75 to 80% of clients. The Body Keeps the Score is like the holy grail for me for body-based trauma therapy. This is where I began. That book was the jumping off point. It's amazing. It's a must read for every practitioner. And finally, Sensory Motor Psychotherapy. This is a great book that's for the clinician and for the client to understand how to incorporate sensory motor psychotherapy techniques to deal with trauma. And there's like 30 or 40 different exercises that are broken down into worksheets for you and the client. It's amazing, amazing workbook. If you have any questions, comments, concerns, anything, this is my information. Again, my name is Keith Lyons. You can reach me at my email at klyonslcsw@gmail.com. I'm also on LinkedIn. You can also access my free trauma resource website, which is The Anxious Mammal. It is a website that I created and I maintain regularly. It will always provide free resources focused on PTSD, trauma, anxiety, stress, and ADHD. So you can contact me easily through there, as well as connect with pretty much any of the information and resources that I presented in this presentation are outlined in detail through articles that I've written, through information and articles and books that other people have written that I recommend, and through numerous different worksheets, videos, and activities that I've outlined that are all listed on that website. So for contact, it's great. For information for you, I give it to all my clients because then it essentially kind of gives them access to me outside of when they're able to see each other in settings, clinical settings. So I hope that this was useful information. I apologize if it was a little fast. I have a time limit, so I wanted to try and get as much as I could in there. But again, reach out to me if you would like any clarification or expansion on anything, or if you felt like anything just didn't seem to make sense with what you believe. I would love to talk to you about it. That's how we learn, is by debating. Thank you.